I think periimplantitis would be probably one of the most challenging conditions that periodontists, at least, which are specialists in the gum disease, they would be facing within the next 10 to 15 years. The main reason actually I was attracted to the laser dentistry and specifically the PEEP and LANAP procedure. And the MVP laser was to see, finally to find something to predictably, or more predictably at least, and less invasively treat the problems around the implants. When I came to the first seminar, I even told them that I'm very skeptical about the laser. That was the first thing that I said. And I was shocked after I saw some of the results. That's so beautiful that I know I could not achieve it with the regular surgery. I could not. And patients love technology, the new technology. That's one thing. But we have to always focus on, does the technology do what they claim? And as I said, I was skeptical, thinking that it might not be doing what they claim to be doing. So that's why I was trying to, in different ways, and trying to sometimes even to make sure it's failing, but it was not failing. And case in point, when I was seeing still this day and age, every time that I walk back to my front office, I get shocked and get surprised that we get some of the cases, we get results that it's unbelievable. There was a patient who had a combination disease, combination infection, which was the infection of the tip of the root, which is called endodontic infection, or root canal infection, and also gum disease, which is the gum infection. She went through a series of different specialists, and probably 9 out of 10, they told the patients it's a molar tooth, and you have infection there, take the tooth out, okay? And I kept insisting with the patient that let's give it a try and see what happens with this. So the patient treated the endodontic infection first, and then once I did the treatment with the LANAP, 3 weeks later, I saw the patient. I could not believe my eyes, because I went from 11 millimeter pocket to 2.5, 3 millimeter pocket, which I could barely even put my probes in. And the patient had a lot of sensitivity to almost zero in a matter of about 6 weeks. And I could not be happier, because that patient was basically in tears when she was talking about having the problem with that tooth for years and years. I still come across many cases that I see. I've been practicing for the last 20 years. I have different population coming in and out with different types of cases. Sometimes I go back and look at the cases and look at the teeth that they've been extracted. And I'm looking at them now, and I'm thinking, I wish I had the laser at that time, because I could keep those teeth in patient's mouth. And so it kind of changes the way you look at the cases and look at the treatment.